Good morning, you guys, it's Karen and I'm here to talk about dysplasia. The particular type that my dog Watson has is hip dysplasia, but this advice will apply to any type of dysplasia and in fact any type of joint pain. I think these things will be helpful, and so the idea is to tell you what will help limit their pain, prevent pain and manage their pain, and basically make their life better with having a joint condition and joint pain. So I'm not a vet, I'm not qualified in anything animal related. That's not true, actually. I have a grooming qualification and I'm part way through a dog behaviour course in animals, but I'm not medically qualified for animals. My medical qualifications are more to do with humans, but I did work in medical research in a hospital for many years and loved it. I left there a few years ago, and since then research has been a hobby of mine. And so the reason I'm telling you this is my expertise, I guess, is in research. My expertise and my interest. So I found out that my Watson has hip dysplasia just last week, and so I set about researching as much as I could to find out. He has mild hip dysplasia, by the way. To find out, is it a fait accompli? Is it something that he will end up in pain in a few years, or is there something I can do about it to prevent it? And it turns out that whatever stage the dysplasia or joint pain is at, you can make it better and you can prevent it getting worse by the things that I'm going to tell you here. And so I think that I really wanted to share that with people. So I'm sharing with you what I've learned, what I've researched in the past week, and I've pretty much spent every spare moment doing this. And my hope is that there's some of you out there, there'll be something here you haven't thought of that will maybe help. Because yeah, kind of the point of this channel, whenever I do any videos on dogs, one is just to share with you Watson, because you know, he's so super gorgeous and so funny and such a little character, but also to hopefully help dogs. I've done a couple of videos on things like separation anxiety and what's worked for us, and how to entertain high energy dogs, because that's something else we needed to do, and this will hopefully help to make dogs' lives better. And obviously some of this is vet advice as well, and you know, a lot of the research has come from what vets have got to say. For us, they haven't given us much advice at all. I'll give you the background on how we found out about Watson's hip dysplasia at the end, just so that we can get straight into the things that are, you know, preventative and help with the pain. For people that may not be interested in the dysplasia part or the hip dysplasia, already know what their animal's got, or maybe it's just joint pain. So number one, and we were told about this by the vet, was to limit movement and to limit sharp movements. And so that means sharp turns, sudden stops and starts. And so for us, that has given us a range of things that we can do. Number one, it means that you're probably unlikely to want your dog to do agility, and specifically things like flyball. Can you imagine with flyball, you have to slam and turn very quickly. So I would say that flyball certainly is out of the question. Agility, there are some people say you could do an agility class if you had an understanding teacher that would allow you to perhaps not do the weaving, because the weaving would be, you know, turning constantly and probably not good for joints. So if you have someone that will do you a tailored course, it might be worth it. So limit movements like that, limit jumping up, and that's something that we need to work on with Watson, because he jumps up. The people he jumps up at are his dog friends' owners. He doesn't do it to strangers, but the dogs that he knows, when he sees the owners, he always has to say hello by jumping and pushing. And it's something that people know about Watson, expect about Watson. I've tried to ask people to turn their back, because that's the only way it will stop it. I'm going to try and do that a bit more, you know, and maybe keep him on lead. That's something else I've thought about before, trying to keep him on lead. But the problem is he wants to play with the dog and the dog wants to play with him, and as soon as you let him off, he will go over and jump up at those people. So we need to think about how we're going to manage that. The other thing for Watson is he runs down our hallway on the wooden floors like a madman when the doorbell goes, and he slips and slides all over the place, and he's several times has injured himself, not badly, but like he'll knock himself and be limping because he's so eager to get to the door and to get down here and sit in his bed quietly while I open the door. And he is very good at that. But yeah, that's not good for him. The final thing with limited movement is think about how he gets in and out of the car. If you can put a ramp for him to walk into the car and out of the car, that him or her, sorry, I'm saying him just because obviously my Watson's a boy, but that will help immensely, because that just is just one, it depends how much it goes in the car, I suppose, but Watson's in the car a lot, especially at the weekend, and that's just one bit that you're removing any impact constantly on the joints. And so we are going to try and just lift him up, because he normally sits in the back with me, or he sits in the back with his harness seatbelt on. So we're going to try and lift him into and out of the car instead of letting him jump. Number 2 is flooring. Have a think about your flooring. And for us, this is really important, because in the hall, like I said, when the doorbell goes, if Watson is at the other end of the house in the living room, he will run at top speed down the hall. And because it's wooden floors that ironically we put down because of Watson's allergies to dust mites, so we took the carpets up, he slips and slides on. And so we're going to look at putting a runner out in the hall, which will have a grip underneath it to the floor and will mean that he doesn't slip so much and doesn't hurt himself. But obviously it's maybe something you want to consider. If you have wooden floors, maybe put a runner down, or if you were thinking about changing to wooden floors, just keep that in mind. Okay, number 3 is massage. I've watched, it's so ironic, the person that I watched was actually somebody who had already watched his videos on migraine relief, and they have worked for me, and it was about massaging your gums when you get a headache, inside and outside. They had several places. There was in your neck, and he taught this push pull release, which is kind of push pull and release. So it's not like massaging round and round, it's push pull release, very, very specific. And he has also done a video about how to massage dogs' tight muscles, because when they have dysplasia or joint pain, their muscles will tighten up, seize up, spasm, and the looser their muscles can be, the more relief they'll get, and the more fluid their movements will be. And so I have watched his video, I've tried some of the techniques on Watson. He seems to tolerate them and almost even enjoy them on his back end. It's showing to massage kind of the spine area around the thighs and even the inner thighs, although you need to be careful with that. Rather than me try and show you any techniques or talk about it, because obviously I'm not skilled in it, I'll link to the video that I watched and that talks about this massage, and then you can decide whether it's something that will work for your dog. Number 4 is perhaps the most useful one, and it is supplements, but there is so much information out there about supplements. It's hard to know what to try because there's so many suggestions, but I've listed the ones that I think are the most useful, and I don't think you need to buy these all separately. So glucosamine is something that has been researched quite extensively, and it seems like it works for some people and not for others. It works for some dogs and not for others. And so it's one of these things that can be extremely effective, and some people swear by it, or for other people it just does nothing. So I think it's definitely worth a try. For me, it would be difficult to know if it was working for Watson or not, so I will probably just use it forevermore as long as he doesn't have any side effects, simply because all he's done is about 5 occasions lifted up his leg, and it hasn't happened for quite a long time. The only other slight thing is he does sometimes bark at dogs that are trying to get him to play, and I wonder if those times he's barking at dogs is because he's in pain and he's like, I don't want to play, I'm sore. So that's one sort of quantifiable way for me to see if it's working. But I have major joint conditions. I have Ehlers-Danlos syndrome, which is a connective tissue disorder and results in arthritis. And so I've had operations on my knees for arthritis and whatnot. So I should be able to take this and see if I get any more longevity out of walking, any less pain, etc. So I'm going to take it at the same time as Watson and see what results we get, you know. But there is some pretty good research behind it. I would say if you're going to get just glucosamine, make sure you get glucosamine sulfate, not glucosamine hydrochloride. Sulfate is the one that has been researched the most, not hydrochloride. So I would say make sure you get glucosamine sulfate. Anything I mention in here, I'll put links to in the description for you. The second thing is chondroitin, and chondroitin hasn't been subject to research on its own. It's always been with glucosamine. They're kind of the perfect partners. So you will find supplements of glucosamine on their own. You generally don't find chondroitin on their own. You'll generally find glucosamine, then you'll find glucosamine and chondroitin. And then there are some that are glucosamine, chondroitin and MSM, which is another compound that's thought to help. And so I have bought this one, which is called Glucosamine Complex for Pets. There's 60 tablets. I can't remember the price, but it was less than £20. It was in Holland and Barrett. I took advantage of their, you know, buy one get one half price, I think it was, or something like that. I'll buy one get one a penny or something like that. And I bought one for myself. Obviously wasn't the one for pets. So this has got in it glucosamine, chondroitin and MSM. So it's MSM. It's got those 3 ingredients in it. So this is what I'm going to try. The amounts that you should take depend on the size of your dog. So I think the best thing is to buy one and have a look at the side and figure out per weight what you should be giving and what the maximum are. That's maybe going to take some research, maybe a little Google research for you, but I would say start on the lowest dose because they can sometimes have a stomach upset. I haven't started Watson on this yet because he's just recovering from his operation. He reacted really badly to the anaesthetic and has had a very upset stomach, etc. So I want to get him fully recovered before I start giving him these for his hip. Something else that is talked about a lot, and I haven't yet looked into the research of it, but I believe there is some good research for humans, and actually there's a lot of anecdotal evidence that it works, is turmeric. But the thing about turmeric is it works best if combined with ground pepper. And so what you can do is either create your own paste that you put in with their food, or you can actually buy this paste. I think it is just called golden paste, and it's turmeric, ground pepper and coconut oil. I'm going to make my own little turmeric, ground pepper and coconut oil paste because turmeric is something I take as an anti-inflammatory instead of taking ibuprofen and aspirin that I can no longer take. And I feel like I have seen some difference. So that's something I'm going to give to Watson. So turmeric, coconut oil and ground pepper. I'll link to a recipe if you want to make it yourself, and I'll also link to the actual golden paste that you can buy. You can buy a packet of it ready-made that you can just put a little bit in their bowls. But the problem with that is it only lasts a couple of weeks. So, you know, you'd need to constantly be ordering it. I haven't ever seen it in the shops. Hopefully it'll be in Pets at Home at some point. And the last thing is omega oils. Obviously, the more oil the joints has, the more smoothly things will glide along. And so I already use something called Umega for Watson, which is just a liquid omega oils, and it's something that I put into his food. I know he doesn't like it. Watson isn't somebody that likes anything fishy smelling, fishy tasting, he doesn't like. And he has raw food, raw frozen nuggets, and I put it on just one nugget. And he always leaves that one, and then he eventually eats it when he's too hungry to care. But you know, he eats it all the same. So I will continue using that unless I find a supplement that has the omega in it, which again, when I was looking for the glucosamine, you can find ones that are glucosamine, chondroitin and omega oils. Be careful when you're looking, if you're just going to, like me, have a look in Holland and Barrett or the supermarket or wherever for glucosamine, you need to be careful that it doesn't, for example, have too much zinc in it, because zinc can be toxic to dogs. You need to make sure it doesn't have alcohol in it, that it hasn't got salt in it, that it hasn't got sweeteners in it. You know, there are a lot of things that could be dangerous to dogs. So I would say, if you can, go for the glucosamine complex for pets. And there are plenty of options on Amazon. In fact, I'll link to one that I was going to buy before I went and bought this from the shops. Number 5, that's all for supplements. Number 5 is know your dog. And when I was telling the doctor about Watson lifting his leg, I was saying to her, I'm so sorry, I'm sure it sounds like I'm a hypochondriac and it's just a little thing. But she said, you know what, it's not. She said, please don't ever be embarrassed because dogs don't lie. She said, and if they are showing a sign, you know your dog the best, then they're telling us something. And she said, and that's all we've got, because they can't speak to us and say I'm in pain. So when you see something and you think, oh, that's a bit strange, she said, that's all we've got. And so never feel embarrassed by that. And so I think you need to bear that in mind with your dog, whether you don't have a diagnosis or do, is when they should let you know, their body will let you know when too much is too much, or when, if they're tired on a walk, you know, if you're walking them and they do the thing that you know is a sign of their pain, then stop. Because Kev and I were talking last night and saying, now if we ever see him lifting his leg, at that point we will stop the walk, and you know, give him more rest that day, because it may be that his hip is inflamed that day or he's over exercised it that day, but we'll let him sort of let us know when he's in pain. The last thing, number 6 on the list, is take advantage of regular checkups, because I would imagine most people are on a plan. We're on what's called a healthy pet plan, and we pay monthly, and within that we get a 6 monthly health check. And I know of some owners that don't go to their health checks, and I think these are really vital, even just to discuss your concerns with them, because you might think it's something small and you might think, oh, it seems to have got a bit worse but not much, and they might do some checks and say, no, he's in quite a lot of pain, or he's not in any pain. You might need painkillers, you might need another x-ray. I think it's worth making the most of these checkups to discuss any issues you have, talk about the supplements you may or may not want to use. They will have the up-to-date information even on supplements, because whilst they might not, they're not covered by insurance and they don't issue them to you, but they do recommend them a lot of the time. And so I think that that's something to make sure you do. There are other things that I've heard of, like acupuncture and acupressure is supposed to be very good, but I don't know anybody that does canine acupuncture at all around here, and that is something I may look at in the future, but I feel like that would be for more acute cases rather than preventative. I'm going to work with the supplements and training him out of the movements that may make things worse for him. A quick background of how I discovered this. We would go on a walk and Watson would suddenly be limping and he would hold up his back left leg. We would pick him up, we would check his paws, we would carry him for just a minute or two, not even, and he'd wriggle and want to get down. When you carry Watson and he allows you to, that's when you know something's wrong, because he normally doesn't want to be picked up. And so he would want to go down again within a minute and he would be fine, and we would be like, well, that was really odd. The first time it happened, we just went, well, that was odd. He must have had something in his paw, but it worked its way out. The second time it happened, we said, that's odd. That's kind of like that last time. Let's have a look at his paw, nothing in it. It's a bit odd. He then went for a checkup at the vet and they checked all of his joints and nothing was wrong with him. Or they said nothing was wrong at that time. Then it happened another 2 times with me, and I just felt like it was something I wanted to get checked out. So I went back to the vet and I asked her to check his back legs. She checked and she pulled the right one back, like completely straight out, right behind him, and it was fine. She did it with the left one and he didn't want her to do it. And you can tell when a dog doesn't want you to do it, because he'll look round at you. I mean, obviously that some of them will yelp, but Watson is extremely stoic. And I know this because although most dogs are stoic, when I was grooming dogs, if you cut a nail too close, it will bleed. And this is something that happens to all groomers. It happens with dark dogs, you can't see where the quick is. If you make it bleed, all the dogs that happened to, which I mean was only probably 4 or 5 dogs in the hundreds of dogs I did, but they would scream and cry and it's supposed to be very painful for them. When it happened to Watson, he barely moved, he barely flinched, and it was bleeding. So I know that he's extremely stoic. Anyway, he had turned and looked at the woman and was pulling his leg back like, no, don't do that. So that's how that came about. He was booked in for an operation to have a lump removed from his back. We're still waiting for the results from that. And so they decided they would do x-rays while he was under anaesthetic. That was last week, and we've now got the results of the x-rays saying he has mild hip dysplasia. That's everything to tell you. I wish the guy was here himself, but he's actually out for a walk. I hope that that's been useful for some people and maybe given you an idea. Please let me know your experiences. This is all new to me. And so if you have anything to add, then I'm happy to hear that in the comments. And I'd love to know if you've experienced of any of these supplements especially, and have you found them useful for your pet? Has there been any side effects or anything like that? I think that's useful for everybody to know. So thank you so much for watching today, and I will speak to you again soon.